Good morning, good afternoon, and good evening. I'm Elizabeth Earle, the Chief Nursing Officer at the World Health Organization. I'm delighted to welcome you to the University of Sydney's Distinguished Nursing Lecture Series. I also want to take this opportunity to commend Professor John Daly for his leadership in this series. I'm from the Cook Islands, a little paradise, small islands nation in the South Pacific. It is where I grew up and spent many years working as both a nurse and a midwife. I held various roles as the midwife in charge of the maternity unit, as a quality assurance manager. I was also the registrar for the Nursing Council, and for a period of time I was the president of the Cook Islands Nurses Association. I was the Cook Islands Chief Nursing Officer in 2011, and later in 2012 became the Secretary of Health, a first woman and nurse to take up this role in the Cook Islands in advising the Minister of Health on budget and policies. Up to this point, I have also engaged with regional and global nursing and midwifery meetings, and later engaged and chaired regional Pacific heads of health meetings. I was appointed as the WHO Chief Nursing Officer in October 2017, but came to Geneva to commence in my role in January 2018. Now, the World Health Organization is a specialized agency of the United Nations with a responsibility for international public health. My role at WHO is to influence and advocate for universal health coverage through an agenda to strengthen nursing and midwifery around the world. We have committed to work towards ambitious global sustainable development goals that by 2030 all human beings can fulfill their potential in dignity and equality and in a healthy environment. We all have to agree that there's nothing more important in this world than the safety and health of the people in it. And over the last 2 years, the COVID-19 pandemic has very clearly shown us that we are vulnerable. We have seen on many occasions that our infrastructures are weak, that our health systems are delicate, and our health workforce is fragile. We knew back in April 2020, before the COVID-19 pandemic took its hold worldwide, that we did not have enough nurses. We knew that each year 13% of nurses migrate to work overseas, many leaving countries that could ill afford to be without them. We knew that many nurses were nearing retirement age, and critically, we knew that more nurses were leaving the profession each year than were joining it. We also knew the reasons why nursing was tipping into a crisis: low salaries, unsafe working conditions, insufficient access to training and education, and increasingly heavy workload and everyday realities for midwives and nurses everywhere. When we look at this from the gender lens, we see women are 70% of the global health workforce and are performing much of the frontline care for COVID-19 response. Nurses alone make up 59% of the workforce, and 90% of nurses are female, and many of whom are the primary carers for their families, juggling pressures at work and home life. The reality on the ground is that in 2020, nursing was already in a crisis, and governments, we had failed to recognize the implications that this would have and address them sufficiently. The COVID-19 pandemic, coupled with this reality, produced significant impact on the economy, health services and related policies, and to the lives of healthcare providers and patients. Over 5 million people have died from COVID-19 around the world, and approximately 115,500 health workers globally are estimated to have died during the pandemic. Sadly, we know that many lives could have been saved if there was better access to personal protective equipment, medical treatments, and especially vaccines. The target to vaccinate 10% of every country by September 2021, unfortunately, saw 56 countries, mainly in Africa and Middle East, unable to do so. And now we have the Omicron variant. This has highlighted inequities at the global level and a reminder that no one is safe unless everyone is safe. WHO has set a target to vaccinate 40% of the population of all countries by the end of 2021 and 70% by mid-2022. and this is supported by a global vaccination strategy. Vaccination alone will not end the pandemic. We need to continue to complement this with good public health measures, maintaining a physical distance of at least a metre from others, wear a well-fitting mask, open windows to improve ventilation, avoid poorly ventilated or crowded spaces, keep hands clean, cough or sneeze into a bent elbow or tissue. The pandemic eliminated the work of health and care workers on a global stage like never before. Midwives and nurses have played a central role during the COVID-19 pandemic, and the complex work of our professions in the areas of public health, emergency care and vaccination has been more prominent and visible to all. Nursing and midwifery are evidence-based professions based in science, so we must use the scientific evidence in the work that we do. Where communities are vaccine hesitant, we must continue to work to promote good communication, working with local leaders and the trusted advocates at local level, and using local knowledge of the communities where we work. We must understand the cause of vaccine hesitancy, acknowledging and addressing concerns, and show our skills as leaders to support people to make wise decisions based on accurate data. Government chief nursing and midwifery officers who have been engaged as part of their country's COVID-19 program received positive reporting on their outreach and teamwork, and in some cases receiving high vaccination uptake. Currently, one of the greatest challenges that we face lies in the retention and recruitment of our nursing and midwifery professions. Countries were challenged to keep their health workforce safe, and many did not have resilient health systems to cope with the prolonged global pandemic. We know that many nurses are leaving the profession within 2 years of qualification. Accounts of burnout, poor mental health, exhaustion, and lack of supervision, poor remuneration are just some of these reasons nurses are giving for leaving. This is heartbreaking, and we must address this. First of all, we must keep the nurses and midwives we have by ensuring policies are in place to address decent and safe work conditions, support and promote good mental health and well-being. And secondly, invest in the education of nurses and midwives to meet domestic demands. Our leadership and involvement in the development of systems and guidance that drives safer patient care is essential, and it is our responsibility to developing a workforce that can meet the standards of a high-quality service and experience every day in every country. Worldwide, the education of nurses and midwives is not standardized. It ranges from a certificate in nursing to a bachelor degree program. We advocate for driving forward a competency-based education where standards are global and the quality of care and the safety of our patients is never compromised. Last year, the 200th anniversary of Florence Nightingale's birth, WHO shone a light on the work of nurses and midwives worldwide by designating 2020 as the International Year of the Nurse and the Midwife. It was also in recognition of the work and contribution nurses and midwives make towards universal health coverage and the Sustainable Development Goals. During this global pandemic, 2 reports were completed. This says a lot about the commitment from our professionals to gather data and evidence during a global pandemic in order to strengthen the professions. WHO, in partnership with the International Council of Nurses and Nursing Now, produced the first State of the World's Nursing 2020 report, published in April that year, highlighting the global issues facing the profession, inequities in the distribution of nurses around the world, a need to accelerate nursing education in order to respond to changing technologies, and advancing models of integrated health and social care, a requirement to create 6 million new nursing jobs by 2030, and the promotion of leadership so that nurses can competently play an influential role in health policy formulation and decision making. WHO also partners with the United Nations Population Fund and the International Confederation of Midwives to publish the 3rd State of the World's Midwifery 2021 report, demonstrating the importance and effectiveness of midwives as core members of the interdisciplinary healthcare teams. The report also highlights midwives as drivers of progress towards the SDGs, At the same time, issues of shortage, maldistribution, and inequities were revealed. Many of you contributed to these two reports in the midst of a global pandemic, and I thank you. In May this year, countries endorsed a resolution at the 74th World Health Assembly, a first for one in 10 years, to strengthen both nursing and midwifery. The resolution is informed by the Global Strategic Directions for Nursing and Midwifery 2021 to 2025, with 12 policy priorities in 4 major areas of education, jobs, leadership, and service delivery. These will strengthen both nursing and midwifery, and I hope it ensures further development of nurses and midwives as leaders and experts at the most senior level, including within government. This commitment to strengthen nursing and midwifery was a very welcome and needed endorsement from member states. Now, as we come to the end of the International Year of the Health and Care Workers, once again, this designation has continued to throw a spotlight on our midwives and nurses responding to a global crisis. During this time of crisis and scrutiny, the work of nurses and midwives around the world has never been more visible. We must see this as an opportunity to influence health and care strategy by taking a lead in advocating to governments to make the necessary shifts in policy and action that is needed to strengthen the workforce that is required to care for our communities everywhere. We now have these resources to support our endeavours to strengthen the nursing and midwifery agenda. The State of the World's Nursing Report 2020, the State of the World's Midwifery 2021, and both reports that inform the Global Strategic Directions for Nursing and Midwifery 2021 to 2025. This is a huge achievement. The data gives us the information and evidence we need to build our workforce to meet the needs of our communities. How many nurses do we need? Where do we need them? What skills do they need to have? It is critical that countries have robust and reliable processes for collecting and analysing data through a health labour market lens, so that it is possible to prioritise our investments in nursing and midwifery to the areas where they are needed most. We must be committed to report on data on an annual basis through the National Health Workforce Account, and update on the policy dialogue and decisions made through the Government Chief Nursing and Midwifery Officers Forum and the International Council of Nurses, International Confederation of Midwives, and WHO Triad meeting held every 2 years. We cannot do this work without strong and effective partnerships where we can make wise decisions based on data, evidence, and context. As we plan our complex work around the implementation of the Strategic Directions for Nursing and Midwifery, the SDNM, WHO will continue to build strong relationships with government chief nurses and midwives, ministries of health, and our key partners in global communities of nurses and midwives, and others, all who bring expertise, experience, knowledge, leadership, inspiration, and hope to some of the biggest challenges that our profession has ever had to face. It is critical as we move forward with the implementation of the SDNM that as a global community, we strengthen our partnerships as we align in our efforts to support countries in their policy priorities in respect of education to address the global shortage, building leadership capacity, and expanding the provision of our practice and service delivery. Nurses have told us that they leave their jobs because they are overwhelmed and working in unsafe or unsupported environments. Many feel they do not receive a fair wage for the roles that they are trained for. Earlier this year, it was reported that over 80 countries were calling for strike action because of unsafe or unsuitable working conditions. It is important that governments listen to the voices of their nursing and midwifery workforce and work together to address these fundamental issues. The Strategic Directions for Nursing and Midwifery 2021 to 2025 offers governments a roadmap to move forward with strategies that ensure nursing and midwifery careers are not only attractive to young people considering their work options, but they prioritize safe work environments, access to education, training, and fair pay, It is these factors that will make people join our profession, and most importantly, it is these factors that will keep the 28 million nurses and midwives in the jobs they are in today. We cannot afford to lose our workforce. Our communities cannot afford to face a future without midwives and nurses to look after them when they are ill. But if we fail to act, if we fail to prepare for the future, and if we fail to address the critical issues we face in nursing and midwifery today, we will fail the very people we rely on to keep our communities healthy. We cannot support our sick and vulnerable populations or keep them safe if we ourselves are unprotected. Our health and care workers cannot provide high quality and compassionate care if they are emotionally fragile. We cannot do this work alone. Senior nursing leaders must be contributors to the discussion and decision-making processes in government around health workforce planning and healthcare strategy. WHO strongly encourages midwives and nurses to work alongside our partners, economists, lawyers, environmentalists, and politicians, and contribute at the table as equal partners with unified goals. From the State of the World's Nursing Report, we know that the presence of a government chief nursing and midwifery officers and national nursing leadership programs are associated with a stronger regulatory environment, a more educated and better governed workforce, and safer patient care. As nursing and midwifery leaders, we now have a responsibility to influence healthcare strategy, to lead in government, and make the necessary shifts in policy and action. We need to build our capacity at senior levels if we are to follow a course to build sustainable health systems that will ensure we are better prepared in the future. Nursing and midwifery leadership must exist in all areas of our professions. As trusted members of our communities, nurses and midwives are ideally placed to lead programs of improvement and change that will address the issues that affect the health of our nations and threaten our commitment to achieving the triple billion targets, Sustainable Development Goals, and universal health coverage by 2030. Our successful progress to achieving these ambitious goals now depends on whether we can address the issues within the context of a world that faces poorer health as a result of inaccessible health services, lack of clean water, and an absence of clean and sustainable energy sources. Many countries already have fragile health systems and are already facing disasters as a result of conflict, earthquake, or famine. It will require reforms in the system and curriculum for training and education of midwives and nurses, becoming context-specific so that they are able to adapt to the challenges faced by changes in population health. We must support the opportunities that technological advances offer to safer and more patient-centered care, particularly in areas where the disease burden is increased, where aging populations, increased NCDs such as cancer, diabetes, heart disease, and the impact of climate on health, and diseases such as Zika, malnutrition, respiratory diseases, and other infectious diseases. We know that mental health illnesses are increasing worldwide. In recent years, there has been increasing acknowledgement of the important role mental health plays in achieving global development goals, as illustrated by the inclusion of mental health in the Sustainable Development Goals. Depression is one of the leading causes of disability. Suicide is the second leading cause of death among 15 to 29-year-olds. People with severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical conditions. Despite progress in some countries, people with mental health conditions often experience severe human rights violations, discrimination, and stigma. Many mental health conditions can be effectively treated at relatively low cost, yet the gap between people needing care and those with access to care remains substantial and effective treatment coverage remains extremely low. Resources have been developed and are available, but we need to be kinder to ourselves and to each other and offer support early or make early referrals as necessary. The global shortage of nurses and midwives are very palpable currently, and many countries rush to advance qualifications of nurses in their final years of training and reoriented and regulated retired nurses in response. Hospitals deployed nurses and midwives to cover the areas in short supply as an immediate response, and those in high-income countries recruited more from other countries for temporary and long-term arrangements, further widening the inequity in healthcare. Currently, 1 in 8 nurses was born or trained in a country other than the one in which they currently practice. Having the freedom and opportunities to choose to work overseas is important, but recently we have seen evidence of poor recruitment practices, including lower wages for nurses from overseas and limited recognition of skills and experience. WHO developed a global code of practice on the international recruitment of health personnel. It was established to promote the voluntary principles and practices for the ethical international recruitment of health personnel, taking into account the rights, obligations, and expectations of source countries, destination countries, and migrant health personnel. It urges prioritization of support and safeguards with the countries with the greatest workforce vulnerability and advocates for greater investment in workforce planning. Its strengthened implementation, financing, and monitoring is critical, now more than ever, as we see the effects of nursing migration across the world. I ask that we reinforce the implementation of the World Health Organization's Global Code of Practice. Alongside this, it is essential that countries, particularly high-income countries who recruit large numbers of nurses from overseas, do not rely on workforce from overseas as a long-term solution to their nursing workforce crisis. Instead, they must focus on creating educational programs of their own that support the recruitment and retention of nurses from within. Another key investment lies in the support and development of early career nurses. Since I started my role as Chief Nursing Officer at the World Health Organization, I have drawn much inspiration from nurses at the beginning of their careers. Their outlooks and views are refreshing to listen to, and I continue to learn from them around the adoption of new technologies as a means to deliver healthcare and communicate with different groups in society. We must maximize their skills and knowledge in these areas. We have much to learn from them as we adapt our health systems to meet the evolving needs of our communities. Throughout the pandemic, we heard stories of bravery and courage of individuals who performed heroic tasks to support their communities and who sacrificed a great deal to care for others. But far more frequently, we heard more communities come together, how health professionals at every level joined forces to work in different ways, and we saw the effects of multidisciplinary and partnership working. The immense power of partnership at all levels, government, academia, clinical, and financial. As we plan our complex works around the implementation of the SDNM, we will endeavour to build strong relationships with government chief nurses and midwives, ministries of health and key partners within the United Nations, and those that champion nursing and midwifery. And of course, our global nursing and midwifery communities, the International Council of Nurses, the International Confederation of Midwives, Nursing Now, our collaborating centres, and many more around the world, all who bring expertise, experience, knowledge, leadership, inspiration, and hope to some of the biggest challenges that our profession has ever had to face. Between us, we now have data. The data gives us the evidence and information we need to have dialogue. Dialogue leads to the decisions. Decisions lead to policy action and to investment. We cannot solve these challenges without strong and effective partnerships where we can make wise decisions based on evidence and context. Over the last few months, my office has consulted with nurses and midwife leaders around the world. We have asked what would help to enable us as a global profession to work better together. It was clear from their discussions that opportunities to meet, share ideas, and learn lessons from each other are rare, but have huge value. To support and strengthen our opportunities to work better together, WHO has established a virtual global community of practice for nurses and midwives. This virtual platform is available to all nurses and midwives. It will provide a network for us to meet, discuss our global issues, and share the good practices and innovation in specialty ways that I know will bring benefit to both nursing and midwifery and contribute to our commitment to achieving universal health coverage. I hope it will bring together both experience and insight from nurses and midwives at all stages of their careers and create more opportunities for us to support each other. We must have robust systems in place that only provide us with up-to-date data, but we must have the leadership within our profession to use it to influence and inform the decisions that are made in government. We have a responsibility to influence those who make decisions, and I urge you to use reliable data and evidence to reach out to those key stakeholders who have a role in healthcare policy. We have an opportunity to turn influence into actions, and our time to do it is now. My overwhelming hope when we emerge from this pandemic is that we build and strengthen our health and care workforce by working together, by recognizing that our successes are not defined by our individual skills and professional capability, but how we combine our knowledge and work with one another at every level to create a better health for all and keep our communities safe. This requires commitment from all parties, including member states and health partners and funders, to invest in the systems and measures needed to promote health across the life course. This includes investment in nurses and midwives in order to protect health and deliver the care and services affordably, effectively, and safely, exactly when they are needed, no matter a person's gender, nationality, or wallet size. Health for all is at the heart of WHO's work to create the environment and means needed for each and every person on the planet to achieve the highest attainable level of physical and mental health and well-being. I thank you.